Hello, everybody. Welcome to the BariConnected podcast. And we are being joined today by Dr. Connie Stapleton. Say
Hello,
hello.
friends.
Oh, for those of you who don't know Connie, you're missing out. You're going to learn why. She's just an amazing person, inside and out, and has a wealth of knowledge. Um, I just want to say, I want to tell you a little bit about Connie. So, Connie, I don't even remember how long ago we met. I feel like it's been quite a few years ago, probably at ASMBS, because I think we were going to ASMBS quite a few times about the same time. And then, um, I don't know, we've kind of met up at quite a few retreats. And I don't know, I got to go to Connie's house a couple times last year.
That was very fun. And you're so easy to talk to. You're kind of my anchor at events. I don't know if you know that, but I'm like, where's
Oh,
Brenda? I need to find Brenda. I'll feel grounded again.
oh, well, I feel the same way because I look for you too. So it's nice having you around. It looks like Trish says, "Hello, Dr. Connie." Trish from
Hello back.
California.
Ah, can't wait to come out there for ASMBS.
Yes, and we were just talking about this. Let's ask Trish if she's going. Anybody else going to be going to ASMBS, which is it's a professional meetup out there. I'm joining here on Facebook. If you're on Facebook, say hi as well. So if you're wherever you're joining on the live event, feel free to say hello. Let us know where you're from. Let us know a little bit about yourself. We'd love to know. And let us know if you know anything about ASMBS, let us know if you're attending that too.
Oh, we got people from all over. Wow, all over the country. All
We
four
sure
corners
do.
here. In the Midwest. Oh my gosh, this is fun. I like seeing where everybody's from.
So Connie's from Georgia and I'm from Missouri. So we have some people. We got one from Missouri here,
Yep, I saw that.
California, Montana,
Canada,
Massachusetts.
fun.
Yes. Okay. Oh, wait, Trish is going to be at Obesity Help. Connie, are you going to that? That's in
You know
California
what?
too.
I planned to go to obesity help. However, my husband and I are going on a cruise to see the Northern Lights, and it's the same week. So we're going to Finland and Iceland. So because the Northern Lights are supposed to be exceptional this year. So it's the same week. So I contacted Kim and I said I wanted to be there, but I'm not going to be there.
Well, you'll certainly be missed. And that's a patient event. So anybody on this call interested, that's called Obesity Help.
I love them. I love them. I love that conference.
It's a big one too. And
Yes,
they've got it really down to a T organizational wise, I think. It's very
they really
organized
do.
and have some great speakers, have great activities. It's
Yeah,
fun.
that's been going
Um,
on for a while.
and I kind of want to just jump in here. So I just want to say today's topic is body dysmorphia or distorted body image. What am I dealing with? And Connie actually jumped on. We had a facility that was wanting us to do this topic together. It was for a private facility and loved the topic so much. Just thought we needed to have Connie on here because it's truly one of those things I think a lot of people struggle with. And what we're talking about here is, you know, as your body changes following bariatric surgery, people often struggle with their body looks, the size of clothing they think they should wear, how they see themselves, how they think that other people see them. And Connie, I think you're a great person to talk about this. So Connie's a licensed psychologist who's worked in the bariatric community for the past 20 years with literally thousands of patients, both pre and post-op. And I think it's interesting too. She has a BariAftercare program. She's also been featured on TLC. I don't have that in your bio, but I think that's pretty dang cool. Tell
That
us
was
tell us
fun.
more about that and about you, Connie, because that doesn't give you justice for what you do.
Okay. Well, I came into the bariatric field by the way of addiction and recovery. And I came into the field of addiction and recovery from a professional standpoint because I'm a recovering addict. And so when I was 28 years old, I think I went into treatment. And at that point, I was not a therapist. I was, I had a college degree, but I had 3 little babies. I was taking care of my kids. I was working part-time. And I ended up in treatment because I found myself addicted to prescription pain medication. Prior to that, it had been alcohol throughout college. Prior to that, it had been food. So it was they talk about addiction transfer a lot, and I transferred my addiction several times until I went through treatment. And at that time, I went to years of therapy, probably 3 or 4 years of extensive therapy. And I realized what an amazing life can be when you have tools for dealing with stress, for dealing with family dysfunction, for dealing with childhood issues, for dealing with, being a grown up in the grown up world, but not feeling like you fit there. So I thought, you know what, I would like to encourage and help other people to find this amazing new kind of life. So I went back to school, got a master's degree and then a PhD, and I started working in this world. And then I was approached by a psychologist who worked in bariatrics. And what I knew at that immediately was that when people go through a procedure like weight loss surgery, they're giving up a substance that provided them with something that made them feel better. Not everybody has a food addiction, but a certain part of the population does. But most people who have, who are carrying around a lot of weight have biological issues, but a lot of them also have some self-esteem issues, some stuff. And I thought, they're going to need what I needed after I gave up my substances. And that was education about how to communicate with other people healthy, learning to set boundaries, about food and about what people can bring into your home, and learning to live life on life's terms. Meaning when I get stressed, or when my parents get older, when my kids get sick, or if I get laid off from a job, I can't turn to a substance to numb me out. I got to learn to deal with these things. So I thought patients having weight loss surgery need a lot of what I needed when I went through treatment. That's how I got into bariatrics. That's how I started this whole BariAftercare thing many, many years ago. And it's just become a home for me. This is where I've done my work for 20 years now. And I love it.
Mm. So right now you work independently.
Yes, I work independently. I do pre-surgical evaluations, and I work extensively in aftercare. I have group therapy online. For the past several years, I've had small retreats for like 8 people at a time for like 5 days. I speak at events, and the BariAftercare program is probably the crux of my work aside from the evaluations. And it's to help patients learn to live a healthy lifestyle, because surgery is a huge part of that. But 2, 3 years into the process, it can get daunting. It can get very difficult. It can get overwhelming. And so I teach a lot of the skills and the tools to help people stay motivated to stick with a healthy lifestyle.
I feel like, you have surgery on your stomach and it changes the physical, can help you with the physical changes, the portion size and all of that. But the pieces with our mind and our emotions and things like that, it doesn't change. The surgery does not change.
It
And
doesn't
so,
change
yeah.
life, doesn't change life from happening. And I was going to say the TLC part came from when I moved from Augusta, where I lived for a long time, to Atlanta. Um, they were filming a couple of different shows there because the production company is there. And I've just been lucky enough to be able to be the psychologist on some of those. And that's been a really fun experience. And bringing it to today's topic, I am doing therapy with one of the guys who's going to be on the season that starts in October of 1,000 Pound Best Friends. So one of the guys, I was having a session with him today, and he said, you know, and now he's lost a tremendous amount of weight, and he's like, I'm really having trouble with this body dysmorphia. And I'm like, whoa, stop. This is what we're talking about today. And I said, listen, let me educate you a little bit about this. So you as a patient can go out there and educate other patients. So everybody who's here today needs to really understand the difference between body dysmorphia and a distorted body image, because it's a term that's being used, and it's being used very inaccurately, not just by patients in the bariatric community, but by professionals as well. People will tell me my primary care doctor says I'm having body dysmorphia. It's like, we need to educate that primary care doctor as well. So they're very different things.
So Connie, I feel like let's jump in. Let me ask you though, which TLC shows have you been on?
Okay, I've been on 1,000 Pound Sisters. I've been on Too Large, and I've been on 2 seasons of 1,000 Pound Best Friends.
Okay. Let me ask you too how this topic fits in. Did you see any of that as these people were, I don't know, did you have any post-op follow-up with any of these
Yeah,
people?
the guy I talked to today is a post-op for one of the shows, and he's the one that brought up the body dysmorphia. So yeah, it was a great segue into today. I'm like, listen, I'm talking today on ProCare about this very thing. So
Well, I
yes.
say we get started because I know it's
Okay.
it's such a big topic to try to cover.
Okay. So if you have used the term, I'm suffering from body dysmorphia, after you've lost a great deal of weight and you're kind of having trouble, people will say, my brain's having trouble catching up with my body. I can't recognize myself when I look in the mirror. When I go into a clothing store, I still go into my 4X size, but I wear a medium, And so people have this very disconnected brain image of who they've been for a long time, that larger person, but their body has gotten much smaller. So that is not body dysmorphia disorder. That is having a distorted body image. Your brain sees your body image one way, but your physical size is different. That is distorted body image. Let me explain what body dysmorphic disorder is. And I want to start out by saying that the reason that this is important is because body dysmorphic disorder is a very, very, very serious mental health condition. And it's not experienced by very many people. It's like 1 to 3% of the population has this. So when we have a whole population of bariatric patients running around saying they have body dysmorphia, it's like, no, if you knew what body dysmorphia was, maybe you would understand why we don't want that to be widespread information. Because body dysmorphic disorder is one of the mental health issues most closely connected to suicidal ideation and suicidal follow-through. So it's an extremely difficult disorder that affects the mind. So here's what it is. It's a serious illness in which a person is very, very concerned about their appearance. So I understand that the bariatric population and the population in general, we're all very concerned about our appearance. But a person who has body dysmorphic disorder, they have like this obsessive preoccupation with a perceived or unreal thing on their body. So it may not even be a real thing. So let's say that I have a mole on my chin, which I do not. But let's say that I did. And I'm like, oh my gosh, this mole is so, so distracting to people that I know when people meet me, all they see is this mole. So I go up to all the people I know and I'm like, you know, does my mole bother you? I mean, I know it's really, all I can see when I look at myself is this mole, and you're like, oh my God, I didn't even know you had a mole there. But in my mind, this is a nightmarish thing. So other people may not even be aware of it, but this is going to take up 3 to 8 hours of my day. not just a little bit of time. I am looking in the mirror. I can't go to social events. It's impacting my day-to-day functioning. Maybe I call out from work because I'm like, oh my God, I can't get this mole covered up right today. And people are just not even going to be able to think in that meeting. All they'll be doing is looking at my mole. So it's this obsession about something that is only real to me, right? And this is something that usually begins when kids are in adolescence. And of the people who are adolescents, 20% of them drop out of school because of this thing, this imagined or perceived thing that they think is keeping people away from them. And 44% of teenagers or adolescents who have body dysmorphic disorder will report a suicide attempt. It has the highest rate of suicidal attempts of any other psychiatric disorder. It's a horrible, debilitating disease. And so what a lot of people will do if they have this disorder is they'll go from doctor to doctor to doctor to doctor, and they'll say, could you remove this mole? So maybe the doctor will remove it, but they're like, oh my God, now there's a scar from this mole. And now all people can see is this horrible scar from my mole. So it's really, really serious. And in the United States, like 2.5% of males have it and fewer in females, which is really interesting. And the reason there's a tiny bit higher percentage in males is because they have this thing with muscles. They'll have muscle body dysmorphic disorder. But the two key things with it are this preoccupation. I'm talking again, 3 to 8 hours a day, being obsessed with this perceived anomaly. So it may not even be real. So that kind of tells you, we're not talking about loose skin. We're not talking about 150-pound weight loss that obviously causes, changes in your body.
So, Connie, I know you do pre-evaluations before surgery. Is there a way to pick up on some of this before surgery to know if somebody might be at higher risk? Because if it's higher risk for suicide, one of the things after surgery, sometimes if people don't see themselves the way they think they should, sometimes that can um spike or heighten,
Sure.
anxiety.
Mhm. I think when you come across a person who has body dysmorphic disorder in a professional setting, you will find out about it because they are so preoccupied with it that they are going to present it to you. And even if they're not intending to, right? Because they're so worried about this thing. So if a person has weight loss surgery and all of a sudden they start getting really obsessed with loose skin or something like that. Hold on, I'm going to mute me because I have to cough
Mhm.
and have a cough drop. Sorry. My husband brought me home a beautiful cold the other day. I said to him yesterday, I said, how long did the sore throat part of that last? He said, only about 2 days. The coughing, now that lasted over a week. I said, oh, I'm looking so forward to that. So today it's hitting me.
Happy
Okay.
Mother's Day.
Yeah, right. So if a person comes in after surgery and they're preoccupied with loose skin or like, I just can't wrap myself around how I look now, a clinician who knows about body dysmorphia will screen pretty heavily for that, but I don't think that's what we're talking about. I think what we're talking about is this body image thing.
And Connie, before you start getting into body image, I'm very curious. Is there treatments for each of these things?
Yes, there
Like,
definitely are.
because there might be somebody on this call that is struggling with that, or there might be somebody, obviously, that's probably many of us that struggle with the other, which is the
Mhm.
image.
That's a great point. And there is treatment. If you believe you have body dysmorphic disorder, you want to find a therapist, a psychologist, and ask them, do you have experience with this? And a psychiatrist. because a psychiatrist will have a much greater understanding of this disorder, because there are medications that can help and there are therapies that can help as well. There are also, what's kind of confusing is that some of the risk factors are the same as the risk factors for all kinds of other things, like addiction or like eating disorders or like binge eating disorder or just disordered eating in general. And some of those risk factors are a difficult childhood, any kind of, childhood abuse, a lot of bullying and teasing, which we know is rampant for children who struggle with the disease of obesity, especially by peers. And there's also some biological issues like serotonin insufficiency or imbalance, which is where a psychiatrist can come in and where medication can help. There's also a correlation with obsessive compulsive disorder. There's a correlation with substance abuse and depressive disorder. So if you look at the disease of obesity and you look at some of the risk factors and you look at the comorbidities, they're almost identical. So that lends a little bit of why people might think that somebody who's lost a lot of weight is suffering from body dysmorphia. A lot of people don't understand it, like I said, even professionals. So if you seek out treatment for this, say, I think I'm suffering from body dysmorphic disorder. I don't know if you're familiar with it, but take in some criteria, and say, this is why I think I have this. Does that help?
And yeah, it helps a lot. And there's a question. Angela says, Dr. Connie, would this diagnosis apply to a patient that believes they have heart damage from bariatric surgery and GLP-1, but every test is negative?
That's interesting. That's interesting. My initial thought is no. However, there could be, or it could be, right? You'd have to see a specialist. It could be conversion disorder, meaning I have this belief. It's not showing to be true, but I have this belief and it's causing me dysfunction in my life, right? So I would definitely see a therapist about that. I am glad to hear that you're seeing the medical professionals who can rule out these things. And if it's completely ruled out by a medical professional, then a therapist can help you work through, the psychological, because that's big. That can be a big deal, right? If you
And it
really
makes
have
me wonder, the question makes me wonder, when you're talking about heart damage, like this person, um, that we're, I guess that the question is about, if it would be what makes them think that they believe it's heart damage, like
Mhm.
makes them
Are
think
there
that.
symptoms or,
Yeah.
and the other thing about heart symptoms, because a lot of us have been convinced we're having a heart attack and we're having an anxiety attack. I don't know the percentage, but I do believe that, if you go to the ER, if you talk to ER doctors, they'll tell you that a lot of people who come in thinking they're having a heart attack are having anxiety
Mhm.
because our heart races or our heart might flutter, and anxiety can cause a lot of those things. But yeah, I would get get some psychological help for that because it's real for that person, right? So you have to have somebody who'll deal with it compassionately, not like, well, clearly it's not. The
Yeah.
doctor said it's not, so what's your problem? It's a problem if it's a problem.
Yeah.
It could be
She
also
says
hypochondriasis.
hypo what?
Hypochondriasis, like I have all these health worries, and
Like a
if,
hypochondriac kind of
yes,
person
hypochondriac.
she said, my patient floats from heart to other parts of their body. So I mean, it's possible, or do you,
The what
maybe
flows from the heart?
they're this person says my patient floats from heart to other parts of their bodies, meaning that they think it's a heart condition, but then also will say, well, maybe I'm having this other part of my body that's from
Yes.
one issue to the next, basically.
So I'm going to
Same
say
patient.
that is not body dysmorphia. That is more like some anxiety, some fear about health related issues, and absolutely get some help for that. I struggle with that a little myself. So I've had to learn some tools to calm myself down, to not panic about, to get the reassurance I need medically and then psychologically. And you have to learn to give yourself a lot of self-talk in those cases. But yeah, I don't think that would fit into the category of body dysmorphia. Are there other questions yet?
Let's see.
At this point.
I don't see anything else yet. Guys, please feel free to ask though if you got anything.
Okay. So if we think about the fact that when you lose a tremendous amount of weight and you look in the mirror, you don't tend to see yourself, right? That's about your body image. That's how you're seeing yourself. I see myself differently than I really am. And that's because for so long, you saw yourself in the mirror, your reflection, as a larger person. Now, when you walk by a window, you're like, whoa, who's that person? Or you go into the store and you're in the dressing room and you're wearing such a different size. That's body image stuff. And so some of the tools that therapists will have people do so that their brain and their body catch up with their smaller size, or as their size shape and shape change. Before you have surgery, get one of those big long rolls of paper and lay down on the floor and have somebody trace you. And if you have to tape 2 sheets of paper together, from a scroll, do it. But have somebody outline your body. And then 4 months after you have surgery, have somebody do it again in a different color. 8 months in, have them do it in another color. 12 months, because then you can see a physical representation of your body changing. And photographs are a good way to do that too, because you have a better perception when you see yourself in a picture rather than in your mind's eye. So,
I'd never heard that before, doing it on paper like that. That's
yeah,
interesting. Kind of a
yeah,
silhouette kind of thing, huh?
you know, yeah, when I worked in eating disorders 100 years ago, that's one of the tools we used, because people would say, when I look in the mirror, because we have this distorted image, right? And it was a lot of times with anorexics who would be like under 100 pounds, and they'd say, I see a person who looks like my grandma, who literally weighs 300 pounds, right? So we'd have them draw it out, and then it's like, that isn't me. And have to work to say, yes, that literally is you, and it's
Hmm.
like, helps people see it more realistically. And that's why photographs are really good. And keeping not all of your old clothes, get rid of them, keep something. So you can hold up the 4X shirt to the medium and go, okay, I cannot look like that because this is what I wear. So kind of some reality checks.
There's another question here too. It says, would excessive hair loss after be something that would be typical? I worry about it now, pre-op.
Of course. I mean, and that is, and you may suffer some self-image issues as you lose your hair, but I think I'm choking on my cough drop. I think most surgeries have an effect on people's hair, and it's pretty true. And you can ask most post-ops, you're going to lose some hair. Again, that's not going to fall into the area of body dysmorphia.
More about image, your
How
image.
about image? Yeah. Oh my God. I'm so proud of my hair. I love my hair. It's one of the things I like about myself. And I'm fearful that maybe my hair will get thin and stringy. Well, that's a real fear, it's okay. So
Yeah.
talk to people about that.
So Connie, well, somebody says the whole body tracing thing would have been so cool to do before surgery. Yeah, like it's something I've never even heard of doing before. So if you have a body image issue,
Right.
what are some things that you can do for that?
Okay. And understand that most people have body image issues. It's not uncommon. Whereas body dysmorphic issues are 2 to 3% of the population, male and female. Body image issues for women are over 90% in this country. So it doesn't have anything to do necessarily with weight. People who are, there's a woman who was a Beachbody coach. Beachbody, which is,
Mm-hmm.
they're affiliated with, I don't know what it is, but so this woman has what most of us would look at and go, how did the person ever get a body like that? And she was speaking at an event, talking about her body image issues and talking about when photographers would say, we have to do a different angle because it shows the fat on your thigh, when the rest of us would be going, I could use a microscope and not find any fat on her thigh, right? So everybody, supermodels, plain Jane on the street, Joe Blow in the factory, most of us have body image issues. It's how we think about our body. Oh, I think I'm gross, or I think my stomach is disgusting, or I think my arms are, oh my God. It's how we think about our bodies, how we feel about our bodies. Honey, I can't go to the thing. I just feel too fat. Doesn't matter if you weigh 110 or 240 or, 370. People have this, I think icky about myself. I feel icky about myself. And body image is also related to how we treat our bodies. So let's think about the correlation. Remember, thoughts affect feelings and behavior. Thoughts and feelings together affect behavior. So if I'm thinking I'm gross, I look disgusting, I feel gross, how am I likely to treat my body? Grossly, right? If I think negatively and I feel negative about myself, especially, I'm not going to treat myself well. I'm going to be like, well, what difference does it make? Give me the gallon of ice cream. Whereas if I'm like, you know what? I'm good enough. It's not about thinking I'm the best of the best of the best. And ooh, look at me. It's like, yeah, I got cellulite on my thighs and a little pooch on my belly. Okay. But I want to live a healthy lifestyle. So I'm going to put healthy food into my body because I think I'm worth it. I'm going to move my body because I know that will keep me as healthy as I can possibly be. So body image is about how we think about ourselves, how we feel about ourselves, and how we treat ourselves, our bodies. Now, what I know from 20 years of working in this field and from my own experience with my own body issues, you find me somebody with an eating disorder, which I had, you're going to find somebody with body image issues. You find me somebody who's struggling with the disease of obesity, chances are good they have some body image issues because they've been bullied, they've been teased, they've picked on themselves. We say unkind things to ourselves about our bodies. So it's pretty ubiquitous, meaning it's everywhere. So almost everybody has negative body image. So when you look in the mirror, when you look in your mind's eye, what do you say to yourself? Working in this field for so long, I know people talk horribly to themselves. Horribly, horribly. And in this class that I do called Gain While You Lose, there's a lot of research statistics in there. And it's like, we have like, I don't remember what the number is, like some ridiculous number of thoughts every day, 60,000 or 160,000, I don't know. And about 80 to 90% of those are negative. And that many are also repeated from the day before and the day before and the day before. So if we're stuck in this, this mindset of, oh, I hate my body and I'm fat and I don't feel good and I feel ugly and why would anybody want to be around me and I can't show myself in public? That's negative body image. And most of us suffer from some form of that. So after you have surgery, your body changes and maybe you get this boost of self-esteem. Like I feel better, I have more energy, I like life better. And maybe you like your body better, but the reality is some people like their body less after surgery because of the wrinkles. So body image doesn't necessarily change. Yeah, you go through a period of where you feel better and you have more energy, and that is great and wonderful. But if you don't change how you're talking to yourself about yourself, which is probably the best treatment for negative body image, it's going to be pretty tough to change any of it.
What's the best way to do that, Connie? What's the best way? Like, would it be working with someone? Because sometimes to get out of your own way, like, what is the
Yeah.
best way?
Well, first of all, you have to become aware if and when you're doing it. So the people that you have in your life, the people you trust, not the people who want to hurt you, because we all have some of those, right? And it may be a family member who's like upset because now you're thinner than they are or whatever. So people who will give you feedback in a way to help you. You say to them, would you let me know if you hear me say something negative about myself, whether it's my body or my talents or my gifts or whatever it is? Because you have to be aware of it. A lot of people don't even know they're beating on themselves verbally. So ask people, would you let me know if you hear me say something negative about myself? Because I want to change it. Or if you are aware of it, then you've got to put in some effort. Meaning, if I say, oh my God, I feel fat. Wait a minute, that is a negative self-statement. That is a negative body image statement. I don't feel like I want to feel, but what's the evidence, right? I've just lost 130 pounds. Am I still overweight? Yes. Maybe today I do feel heavier. What am I going to do about it? Am I going to cave up in the house? So how am I going to deal with that? Yeah, I do feel fatter. That is a reality. I feel fat today. Okay. Given that that is how you're feeling, what are you going to do about it? Are you going to sit home and think about how fat you feel? Are you going to say, I'm not going to go to this social event because I'm feeling fat? Or are you going to say, you know what? Just because I feel that way doesn't affect how other people feel about me. My friends like me. They like me being part of the group. They like me being involved in the events. I'm going to show up and I'm going to go hang out with them. So part of it, hang on. Sorry about that. Part of it is being aware of it and then making a choice what you're going to do about it. Are you going to let this defeating thought overtake your life? Or are you going to say, okay, I'm not going to let this stop me? And what happens the majority of the time is if you follow through with your plans, once you get out and about and you're doing things, you forget about the self-absorption of feeling fat, because it is kind of a self-absorptive kind of thing, right? Oh, I feel fat, I feel fat, I feel fat. Nobody gives a rat's patoot. You get out with your friends, they don't want to hear about it. B, they want you there because they love you, just like you want your friends around because they add joy to your life. They're funny, they're fun to hang around with. You like similar things. So you kind of get out of yourself.
Connie, there's a couple more questions here. Kind of one of them is going back to what you were talking about, them being two different things, the body image and the dysmorphia. Is there a chance that someone might have both?
Absolutely. Absolutely. That is truly a possibility. But
Okay.
remember the prevalence rates. Very few people actually have body dysmorphia. Almost all people have body image issues, but yes, you can have both.
And are there positive affirmations? Are positive affirmations really useful in learning to love your body?
Um, I'm going to say yes. I'm going to say yes. We're going to go with yes. There are people who say there's no science behind that. Um, but my thought about that is I would rather be saying something positive to myself any day than not. Because if I'm saying something positive or at least neutral, I'm going to hopefully, if I say, oh my God, I look like crap, versus that's not a very nice thing to say to myself. I wouldn't say that to my friend. I go, not looking my best today, but it's good enough. At least that's neutral, right? And it's going to raise my confidence a little bit. It may keep me going, you know what? And the bottom line, friends, is nobody really cares. Nobody really cares, right? People love you because they love
Mhm.
you. If you stop for a minute, we'll do a little exercise here. Let's stop for a minute and everybody just think of the 3 or 4 people in your life that you love the most for whatever reasons, right? And then think about what are those reasons? Why do you love these people? Maybe they are, just hysterical and you always have good time with them. Maybe they are just the most compassionate person and you're like, oh, I love being around them. It makes me a more compassionate person. Or maybe they're just so smart and they add new dimensions of meaning or, things you're not familiar with. Or maybe it's somebody who has something really in common with you. But think about these people, the reasons you love them. Did any of it have to do with what size they were? If you liked how they did their makeup, if you liked how they had their haircut, I'm guessing it didn't. And the truth is, friends, when people think about you, they think about what they love about you, not about, if you're feeling fat that day or if you don't like your haircut. I can't remember
Yeah.
where I was at. What was the
No,
question?
I think you finished the full, I mean, you went full circle with it. I think that's great. Um, there's several comments around this. Somebody's agreeing and saying that what you were saying about going places because you felt bad stop them from going a lot of times. So it kind of like what you're saying is helping to change their perception about that. And then another person says, I look in the mirror and hate the saggy skin and the wrinkles. And then I realize, this thing refreshed. And then I realize that no one but me gets to see those things right now. And when I'm dressed in my new small clothes, I look again and say, damn, I look good.
Yes. So, it's true. Now, I promise you, if I stripped and went naked right now on this video, you would see that I have all the same things. My weight may be smaller than some of you, maybe more than some of you, but I promise you I have bat wings. I promise you that I have a ton of cellulite on my thighs. I promise you that I have a belly. You know, do any of you really care? Do you really care? Absolutely not. So I'm not going to run around naked. It's not my thing, right? If you want to run around naked, you do you. But
We
if you
might
don't,
get a lot of new watchers here, Connie. That could be really interesting.
woo, buddy, I'd have to do therapy with them and say why. But here's the deal. Here's the deal. Put your clothes on and go, oh damn, look at me go. Right? And go and do. Because here's the deal. Here's the deal, Brenda. When I talk to people before surgery, here's what everybody wants. They want to be healthier and they want to do more things that they want to do. They want to have a fuller life. They want to get out there and do things that their weight prevents them from doing, and they want to do them with the people they love. But what happens after surgery? For I don't know what percentage, but for too many, is that 2, 3 years later, they're like, but I never got to my goal weight. But I don't like how and I get not liking how your skin looks. I get that. And that can be a real thing. What I learned when I went to treatment, and a lot of us have fear, right? I don't care what your issues are. Most people have some fears. And what they teach us is feel your fears and do it anyway. So have your fears about your skin and go live your life anyway. Have your fears about, have your dislike of the bat wings running, put on a shirt and go do the thing. It's about living your life. But my sadness comes from before surgery and then after surgery, people come back to this same dysfunction, which is focus on the body, focus on the skin, focus on the weight, as opposed to doing what you said you wanted to do. You are now at a healthier weight. You are now able to live your life and do many more things than you could before. So why are we not doing those things and celebrating, which I know you're doing, but must we bring the it's not good enough into it? Because so many people have lived with what you did all your life is good enough from parents or teachers or grandparents or coaches or whatever. And now you're going to do that to yourself? Let's get out there and do the things you wanted to do before you had the surgery. Get healthier, get that body to a weight that doesn't prevent you from doing the things you want to do. And let's get out there and do it instead of this head nonsense. I say nonsense, it's my work, right? It's my life's work. It's not nonsense, but let's do what we have to do to work through that, because now it's not your weight preventing you from living the joyful life you wanted to live. It's the thoughts, it's the thinking. And I was going to say this earlier. Professional athletes will often say that 20% of their sport is physical, 80% is mental. But in practice, they spend 80% of the time on the physical aspects and 20% on the mental. So it's backwards, right? Same with weight loss surgery. 80% of this, and this is a fictitious number, but a great deal of this is changing the head stuff. The surgery is a small part of it. And yet we focus so much on the physical when there's so much mental stuff in our way.
I'm just reading some of the comments. There was one a little while back, Connie. But one thing I want to add to that, what you just said before I kind of get into the comments here is, a lot of times we have these things in our mind that we want in life. And I mean, that's just part of being human. Like
Right.
that's never going to stop. Like what we want. Like we have, maybe it's a different body, maybe it's a different car, a different house, a different job, whatever it is. But why do we want those things? We want them because we think we will feel better.
Right.
Okay. And the realization is that you can feel better right now, regardless. So whether it takes your imagination or whatever it is, you can put yourself in that exact same spot no matter where you are. And that's what happens after weight loss surgery. I think we think, you get to that size and then you think, wow, what happened? I'm here, but I don't feel different.
Yeah.
So it's about choice in how you act and react.
Yeah, it's like, yeah, when I get married, I'll be happy. When I get the degree, I'll be happy. When I get the promotion, I'll be happy. When I get to this size of clothing, I'll be happy. But, then it's kind of scary for some people. They're like, I put every miserable thought and feeling I had into weight being the problem. But I've lost the weight and sometimes I'm still negative and sometimes I still don't like myself. And by God, I don't even like my mother-in-law and I didn't like her before. It's like, all of those things. And it is kind of a rude awakening. And I love what you said. I love visualization. I love imagining myself being happier. And then I can put myself in a happier mood by imagining that. I love all of those things. Yeah, we got to fake it till we make it sometimes. And we got to put a lot of effort into it. It's like, okay, I'm feeling grumpy. Is that how I want to spend my day? Is that how I want to affect the people around me? Well, if it's not, then I got to do something to be a little more cheerful.
And we always have a choice.
We always have a choice. Always.
Always. I think that there's a gift in a little bit of I don't want to say displeasure, the knowing what you don't want, because it definitely makes what you do want very clear. You don't have to spend time. You can see, you can figure it out, and then you can say, okay, moving forward, right? You know,
Absolutely.
this brings in a question here. It says, do people say they feel like they have imposter syndrome? So that kind of is the same.
Absolutely. Gosh, that's an interesting that you bring that up. That's what I'm talking about when I go to the professional conference, imposter syndrome, for sure. And people do feel like an imposter. It's like, here I am now at a weight that I always wanted to be, but I don't know how to do this life. I know how to do life at that previous weight, but I don't know how to navigate the world here. And so, yeah, we look to other people for cues. We look to, that imposter syndrome is a real thing. And I would do some looking at that. I have a podcast called Bari Aftercare, and I have a whole podcast on imposter syndrome. And a couple of weeks ago, I did one that I would really encourage everybody to listen to, especially people who are struggling to stay motivated to do the things they have to do following bariatric surgery and to uh, keep the weight off. And I did a two-part series on a book called Why People Don't Heal and How They Can. Meaning, if I've dealt with this disease of obesity for so long, and then I have surgery and I lose the weight, and yet I go back to those old habits, I'm not working to heal the parts of the disease that I can manage, because some parts of obesity you don't have any control over, and some you do. So if I'm not doing the work on the parts that I can, why am I choosing not to heal? And the book is by a woman named Carolyn Myss, Myss. But I go through that book and it's fascinating what she talks about when it comes to people's willingness to change and the reasons we're frightened of change. And that's where that imposter syndrome can come into. But that's a really good two-part episode in
Thanks
bariatric.
for sharing that. It looks like Jody posted the links. That was
Thank
incredible.
you,
She
Jody.
posted those. That's wonderful. To the links to your BariAftercare podcast. There is a question. Is it, it, is there the fear of freedom to be able to do more for some?
Absolutely. And I understand that question. Is there the freedom? Is there fear of the freedom to do more? Of course there is. There's freedom to be like, well, can I really do that? Do I have what it takes to go out there? Like maybe I want to, do a social media channel. I have the freedom to do that now, or in my head, I have the freedom to do that. Or maybe you have the freedom now to jump out of an airplane because you couldn't at a heavier weight. It's like you have the freedom now. Are there fears associated with that? Absolutely. Because again, maybe you don't know how to be that person, or maybe you don't think you deserve those things, or maybe you are ill-equipped to have the skills to do those things. All of that can be overcome with learning some new skills or doing some therapy, if it's something you really want to do. But that's a beautiful question, and the answer is absolutely.
And I'm taking two more here real quickly before we get ready to close. Uh, Jill says, we had your podcast in our support group last night.
Oh,
Yay! She said, can you share some books of yours?
oh,
Some of your
sure.
books.
Sure. Thanks for asking. Well, one of the books, my most recent one, is called Mind Prep, and it may be my favorite, even though for a long time my first book called Eat It Up was my favorite. But Mind Prep may be my absolute favorite, and it's for pre and post-op, even because you have to keep changing. Your mind has to keep growing as you go through this process. But Mind Prep is probably my favorite. I have weight loss surgery does not treat food addiction. So if you came into weight loss surgery with any kind of addictions other than food, and maybe you came in with food addiction and didn't know what it was, and now you're like, wow, I think I was addicted to food. Read this book. Weight loss surgery does not treat food addiction.
That's one
One
of
of
yours too, Connie.
yes, and the other one is Eat It Up, which I wrote many, many years ago, and it's due for a volume 2. I'm currently working on one called Gain While You Lose. So like gain insight, gain wisdom, gain skills and tools while you lose weight and bad habits and negative thinking. So I'm currently working on that one. And I have a daily, like a book of a daily way to monitor your life, not just your weight, not just your food, but what did I do well today? What am I proud of? What could I do differently today if I did something that I'm not proud of? So it's kind of a whole life kind of way to look at of your life. So there's that too.
So, Connie, I'm going to show them. Is it okay if we jump to your website and show them a
Sure,
few things?
please.
Okay. Um, I'm going to share my screen. There's another question too, as I'm doing that. I may have you answer. Do you have any tips for fixing our internal dialogue while I go to your website?
Absolutely. You have an internal dialogue. Some people in the cognitive behavioral therapy world call it automatic negative thoughts, if we're talking about a negative dialogue, or your script. And a lot of times your script or your thoughts, it's automatic, it's automatic, it's automatic. So recognize it for what it is, and then say, is this how I want to think? Or do I want to think a different way? So if if you're used to describing yourself as, I'm a fly on the wall and I just am, and the one people always come to for help, people always count on me. You have to decide, what do you want your script to be? What do you want your narrative to be? And then make it that. So first of all, awareness is the key. What is my automatic thought? What is my elevator speech about my description of me? And then ask yourself, what do I want it to be? How do I want my script to end? You are the author of your own life and you get to choose it, but you have to write it, right? We write it in our brain first, and then we're going to live it out. So you have to decide, do I want to think, ooh, everybody's looking at me. They're thinking, oh my God, look at that person with the saggy skin. Or you could say, you know what? If they are looking, oh well. And the truth is, probably most of them aren't. So you have to choose what you want to make the automatic thought into. Look at
So here we have your website. Connie, I'm gonna
that.
also mention here, Connie she's been a big supporter of ProCare, which is our sponsor today. I just want to give them a shout out. And um, we do have a link that Connie that is actually saves you money. Uh, the link is on her website, it looks like here as well, but you can also find it on the ProCare one. I'll show you how to do that as well. So tell us, Connie, about your BariAftercare. It looks like here, this code right here is Connie Stapleton, and that's for ProCare products.
Mhm.
So if Connie is an affiliate of ProCare Health, and so you can get a discount on ProCare Health products. But then we also have a way to we call it a partner program with Connie. Connie, should I show them off of our
Sure.
website how to go to
Yeah.
that? Okay.
Yeah.
So if you get on the ProCare Health website, just procarenow.com. And when you get there, you kind of go over to the tab that says BariConnected, which is our podcast that you're on listening to now. And under BariConnected, we have partner programs. And when you click on to the partner programs, you're going to see some of our other ones, but Connie's is right here forefront. And when you press the learn more button on that for BariAftercare, it's going to show you what all you get. There's a heck of a lot you get with her aftercare program. And if you press this subscribe to BariAftercare, it's going to bring you on her page and it's going to show you what kind of discount you get there for that.
Thank you for doing that. I love BariAftercare. I'm telling you, it's kind of my baby. Um, it's, I tell you, people need support. And in the world of recovery, like the 12-step community, people have a home group. So you can be on a lot of, social media kinds of things, but it's nice to have a home group where you can get to know the players in the room. And there are like 4 or 5 people who contribute to this as kind of my team. But everybody who subscribes to this becomes part of our team. And it's nice to have people you can count on, you can rely on. And it's information, Susan Mitchell, Dr. Susan Mitchell, who is also a part of the ProCare world. And she has a wonderful podcast, Bariatric Surgery Success. She's got a PhD in nutrition and works as a dietitian in the bariatric community. She contributes, and a lot of other people who many of you would know. But every day we have what we call a daily take, where one of us gets on and we just talk about what's going on. We have a word of the week. We talk about that. We hold people accountable. It's like, what do you want to be held accountable for today, and how can we help you? And that's helped me a tremendous amount. Man, I've cleaned out closets, I've cleaned out drawers, because I'm showing pictures of those saying, I said I was going to do this, and look, I did it. And if I didn't do it, I go, you know what, didn't get around to that. Somebody want to give me a tip on how to get started with that, or whatever it happens to be. My daughter and I do cooking demonstrations on there. We post the bariatric friendly recipes. We do movement. I have chair yoga. I have floor mat yoga. I do a meditation every week. So you can just use that, whatever day, and just slow yourself down. There are texts that come to you. There are emails that come to you. It's constantly giving you stuff to keep you motivated and help you stay connected, because we have to immerse ourselves in the life we want to live. And you want to have a healthy BariAftercare journey. It's a whole lifestyle, not just eating.
I'm just listening. Yeah, I forgot to mention earlier that you were a yoga instructor too. I mean, that just adds to every other thing that you've done. It's pretty
Yeah.
cool. So guys, if you go to the procarenow.com website, BariConnected partner programs, and then you'll find Connie's BariAftercare program and all the different things it includes. And if you subscribe using the ProCare link, you save 15%. So I also want to, Connie, is there any closing thoughts before I kind of do a little shout out? Because we have a promotion going on too. I wanted to share.
Yeah, for sure. No, just remember, as your body changes after weight loss surgery, it's body image distortion. Chances are it's not body dysmorphic disorder. Please educate people about that. But if you do think you have body dysmorphic disorder, then see a mental health professional. And my podcast is free. Same name, BariAftercare. I have over 170 episodes, and it's all about the head stuff. So check it out.
Connie also has, if you're wanting to find her on different forms of social media, she has LinkedIn, Twitter, YouTube, and Facebook. So Connie, I'm going to paste that into the chat box. So if
Okay.
people are wanting to find you, it's pretty easy just remembering her name, Connie Stapleton,
Yeah.
because that's pretty much how they can find you on any of these links, which makes it, whoops, I forgot that I was forgot that I was sharing. Here, let me paste it. Paste it right here. Whoops, got to do it to everybody. And I'll paste this on Facebook here in just a hot second. Okay, so changing my view so I can go back, kind of skipping around on screens here, guys. Sorry about all that. Well, Connie, I want to kind of give, I also want to give them a little promotion that we're offering here. And I'm going to share my screen once again to be able to do that. Okay. So if I go back to the ProCare Health website, ProCare Now, we are offering a special promotion with our probiotic plus bariatric multivitamins. So we were the first company to start offering that. I'm going to pull up that product. How you find it is under our bariatric multivitamins. And when you get there, you kind of page down on the page just a little bit. And it is a blue and a purple bottle. I have it pulled up here. So you can save 15% off on that. Today we have a 60 count bottle and we have a 180 count bottle. Those are um, twice a day. Most of our multivitamins are one a day, but this probiotic version, because it has so many different things in it, all of these probiotics, it's larger in size, I guess. So two capsules instead of one. So you can use the discount code, which if I go back here, it is BARI 15. Expires today at midnight, basically. So you have all day today. You can actually use Connie's code, which I'll share with you here shortly as well, to have that. So you could have two discounts. You can have the 15% off plus Connie's discount code for another 10%. So saving all kinds of money. And probiotics, you guys, are one of those things that there's been a lot of research on them as far as gut health. Our gut is considered our second brain. It's a way to feel healthy, feel better. And then also, it's been known too, they've done some studies. Stanford did a study on weight loss, and it's supposed to help encourage weight loss too as you're on your weight loss journey. So sharing those two things. I also want to just kind of give a little shout out. If you're looking for upcoming episodes under this BariConnected tab, if you click on that, guys, you can find any of our upcoming May episodes. Each month we change this page out to be whatever we have going on.
Henry,
So yes,
my friend
you and Henry has
Henry.
done it. You've done things together too, haven't you?
Hmm. I love Henry.
And we have Ashlyn, which
Oh, and
Ashlyn was at your
Ashley.
house. Yes.
Yes.
She's going to be
Oh, my
talking about,
friends.
she's a mental health specialist as well. And
Yeah.
then at the end of the month, I've not met these people in person, but I'm looking very forward to talking to them, Nick and Becky. They're a husband-wife team that is going to be talking about running, lifting, and nutrition for the bariatric athletes. We have those, and then we have a support group, which I know you know Rob too, optimizing movement after bariatric surgery.
All my buddies. All my buddies.
So we have a good group this May, and then you can just click onto any of those to subscribe. As in Connie's podcast, we also have a podcast, BariConnected. All of these recordings get on there. We have a YouTube channel, so I'll pop on that. We have over 200. We have 270 videos. If you press the subscribe button, it should be up here when you go, and you'll see. You'll be able to know when podcasts first come out. Connie also has a YouTube channel as well, so you could check out both of those. And then the third thing that I want to say is on this BariConnected page, we also have our Facebook page and our Facebook group, and it's a great way to interact behind the scenes after these events that we have live. So stop sharing. I'm going to share Connie's affiliate code, which I haven't done before. Oh, and I say hello. We got some people saying hello here, so I want to
Hi,
say
y'all.
hello. um, okay. And I'll be putting this on Facebook here in just a hot second. It's just for some reason my screen's changing over. Well, I just want to thank everybody for joining us and just tell you how much we both appreciate.
Definitely. And I appreciate you. You're so good at what you do. So good at what you
Um,
do. And you're such an
Thank
awesome
you.
person, aside from what you
Thank
do.
you. You're so sweet, Connie. I appreciate that so much.
You're welcome.
Well, hopefully we'll get to spend more time together in
Yes.
this year.
I'll see you in a few months.
Yes, 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 yes. Well,
Next month.
everybody just have a great day. I know. Yeah. Everybody have a
Thanks,
great day.
everybody. I
And
appreciate it.
until the next time, everybody have a great week. So thank you so much. Bye, everybody.